When we first passed the legislation, Early Childhood Iowa was known as community empowerment. A founding principle of community empowerment was that we needed more collaboration. We had too many silos. We needed the Department of Education, Department of Human Service, and the Department of Public Health to start working together and collaborate. So collaboration was a founding kind of principle of all of this. So that required that we work with the directors of each of those agencies. We wanted to empower the parents of newborns in the state of Iowa. What we learned is that 85% of the brain is developed in the first 5 years of life. And we think we were missing opportunities in the state of Iowa to help those brains develop.
Early Childhood Iowa is very important to the community. We are the local early childhood system builders. And a family can move into our community with one phone call to the ECI office in any of the ECI areas and find out how to navigate the local system. Where do I find child care? How can I get in-home services? Linn County Early Childhood Iowa is currently funding 16 different early childhood programs. We tend to categorize them by the type of service that they provide, and we are currently funding the CART program, which is the Child Care Alliance Response Team, and our TIES program, and those both focus on child mental health and behavioral supports. One category of programs that we fund would be our preschool and child care services, and we have contracts with the Cedar Rapids Community School District, College Community School District, also with Early Head Start and Head Start programs, the Linn County Child Development Center, and we also contract with PACES to Quality to enhance the quality of child care. The second broad category would be child and family resources, and that's where our in-home visitation and our group parenting classes fall into, and so we have a contract with Horizons for in-home visitation services, the Linn County Program for Nurturing Parents, the Partnership for Safe Families, and the Parent Education Consortium. The last category of programs that we fund would be preventative child health screening. So we have a contract with the Family Community Health Alliance to provide vision, dental, hearing, and developmental screens. Then we also fund a child care nurse consultant, which is a specialized nurse to go into child care centers and make sure there's injury prevention checklists, immunization records are up to date, and to help with any medically fragile children.
In different parts of the state, ECI programs meet different needs, and that's, I think, the beauty of the whole ECI system, is that we give an appropriation, those appropriations go to different areas, and then those areas are able to meet the needs of what the kids need in Northwest Iowa versus Southwest Iowa. And it's been nice to see that the program coordinators have adapted to that, and they're being very creative with the dollars. And I think several of the programs have proved that they are using the money well and that it's going to good work.
The way that programs can connect with us is when we offer our funding available to the community on a competitive basis. They then can apply to the local board, and if their proposal is successful, we would enter into contracts with them. There is no cost for an agency to be a participant with Early Childhood Iowa Services, but we do have accountability measures that we ask them to maintain, which would involve submitting claims to us monthly so we can monitor the utilization of the funding, submitting quarterly progress reports so we can monitor how well they're doing on the data in regard to meeting goals of serving families, and then we also do on-site visits of the programs annually, and then we often ask them to come and present to the board on a more informal basis so we can just get a better sense of the services that we're funding. Once you join Early Childhood Iowa, you're part of a network of local providers that share resources and share expertise. Other services that we provide at Early Childhood Iowa programs are community forums so we can address what our emerging community needs. We also update a community plan annually so they have access to current data and research on early childhood.
Getting them off to the right start is a huge foundational piece of their development and growth. And if you believe in that, then you would believe in investing in that.